The work that we do here, like there's no denying that SunCloud is special. There's no denying that the model we have is not only special and relevant, but vital, to addiction and eating disorders.
Someone said thinking and working outside the box, which I think really characterizes Dr. Kim and the whole staff at SunCloud. And this openness to further learning, this openness to doing it better, not thinking that you know already, because I see so many psychiatrists and therapists and programs out there that have kind of closed the lid on future learning, and they've got their protocol down, and they're not open to changing it.
And I'd worked in the field for decades before I came to SunCloud, but it was always either mental health or addiction. But it never came together the way it comes together at SunCloud.
And I always love the term sun cloud. It's kind of contains that yin yang of light and rain, and that reconciliation of opposites that we often have to do in good integrated therapy. We're constantly evolving. The field is constantly evolving. I'm hopefully constantly evolving. And I think when we know that, we end up being there for our patients and delivering better care.
Over time, that evolved into my identity as a psychiatrist being formed. I don't think I recognized all the things that were important to me about my work until I had the SunCloud experience. And the integrative model, the way that we think about patients wasn't just lip service, it was actually real.
And it was really, especially meeting you, Kim, you were really the first psychiatrist that I had met that really understood co-occurring disorders and especially addiction. I remember the first time that I said drug of no choice in your office, and it was just like I was so relieved to meet somebody in the field who really understood.
The biggest growth curves for me is along the lines of health equity and inclusive care and not culturally competent, but like Eleanor, when you were talking about oh, this is a person who gets it, that experience, or this can be a home for me, that experience, and really not wanting it to just be a lip service kind of endeavor, but to have people of color, people of, different ability levels, people of different sizes, actually feel like they could receive care here that saw them, and appreciated who they were and responded to that seeing by changing something in us and changing in something in the way that we go about showing up in the world.
I was used to processing information, but not, processing trauma, which is really something different than I had ever been a part of, and not just psychoeducation, didactic, skill building groups, this whole processing piece was really, really good.
I'll never forget Dr. Kim walking my husband down the aisle at our wedding. I'm like, you should have somebody walk you down the aisle. He's like, I want Dr. Kim. I was like, really? It's only been recently where I could see how valued and cared I am for, that this isn't just a job for me, and I'm not just an employee to you.
I think that's a beautiful example of what has happened for me at SunCloud. That kind of clinical faith and support through all the ups and downs. And I've also had those with SunCloud and landed on my feet stronger. So yeah, I'm grateful to be a part of this organization.
Kimmy, I appreciate what you said. I can't always see how people are caring for me. And I think that really encompasses, this really feels like family, right?
One of the first clinical supervision groups that you came in that I was leading, and we were very much similar to a process group, like in the way that the supervision groups were handled. And I remember that first group, I think it was the first time, in the whole group, we intervened and sent one of our lead TCs to treatment, and that needed to happen, right? And the group did a beautiful job. And I think that's sort of let people know that, that this is an organization that will support healing for the clinicians when they
Yeah.
end up having some of their own struggles.
And it's really one of the only programs, I think, in the country that truly embraces both eating disorders, substance use disorders, and food addiction, and treats PTSD and trauma-related disorders, such as dissociative disorders. There's been a lot of BS and wrong thinking in the field of psychiatry, and hopefully and luckily we have evolved and we're continuing to evolve. And being oriented toward research, I believe that's a part of what helps push the envelope.